have nasal conchae. Do you remember that the inferior nasal conchae was a separate bone? What bone were the superior and middle nasal conchae? Oh, right. Okay. So here we have the nasal cavity. It's all lined by nasal epithelium. So nasal cavity with the conchae. Okay. We take a look at this fold right here is the entrance to the eustachian tube. That eustachian tube goes to the middle ear and equalizes that. We have some tonsils, which are tonsils are pockets that collect bacteria that are rich in lymph tissue. So we have a lingual tonsil, we have a pharyngeal tonsil, and a palatine tonsil. Okay, another name for those is adenoids, but they're just folds of tissue that collect bacteria, and there's lymph nodes there, so it educates our immune system, so they're really part of our immune system. When we take a look at the pharynx is this huge region here. From here up, we have nasopharynx. Directly behind the mouth, we have oropharynx, and when we close the epiglottis, this would be the laryngeal pharynx. So really, when we take a look at the pharynx, it's a common area for food and air. So we have this pharynx, nasopharynx, oropharynx, and laryngeal pharynx just above the epiglottis. Okay, I am touching the epiglottis. I'm also taking a look at, here I have maxilla bone, palatine bone, then I have the soft palate. Soft palate's made up of soft tissue. Hanging down the back is the uvula. In terms of cartilage here, I have a thyroid cartilage that's been cut away on this model. So here, this is thyroid cartilage right here. It would normally come around this. I'll grab one more model because I'm missing it. I'll get it in a moment. And here I have the cricoid cartilage. So I have epiglottis. I have the thyroid cartilage, which has been cut away. I have the cricoid cartilage here. Finally, I'm down to trachea, and the trachea is soft in the back so that the esophagus can expand into it.
Double A. Supposed to plan these things. Double A.
And here I'm taking a look at the voice box of the larynx, and several things show up on this here. We'll look at this one here. Okay, so when we're taking a look at this, here I'm looking at the front. Here I'm looking at the hyoid bone. Okay, so here I have the hyoid bone. Here I have the thyroid cartilage. Okay, large one from the anterior portion. On the posterior portion I have the cricoid, large from the posterior segment. So I have the thyroid cartilage, here I have the cricoid cartilage, okay? Now, on the posterior segment, okay, anterior, posterior, I have a arytenoid, which, looks like a 4, and at the very tip I have the corniculate, which there's probably a number there, but I can't read it. What would you call that, a 6? 5? There's no idea?
Looks like a B.
Looks like a B. 4. I can tell you the arytenoid is 4, and what's above it is another number. Could be a B, but there are some letters. No, I don't know if there's letters on here. But anyway, the corniculate is right at the cornice. It's a little tiny piece, rice-sized piece of cartilage. So on the cartilage, again, I have the thyroid, I have the cricoid, I have the arytenoid, and at the very tip I have the corniculate cartilage. Okay, when I look at cross-section here, this is the epiglottis. Okay? So here I'm looking at the epiglottis. I have hyoid bone. Oh, I know. We have the ventricular fold, which is the first fold, which is the false vocal cord. The one below it is the true vocal fold. Okay? The space between them is the glottis. We have, this is trachea, and here's the thyroid gland.
And parathyroid gland or no?
Parathyroids are like little beams. I don't see them on here. There's 4 of the parathyroids on top of it. Okay. So again, on this model, I have the hyoid bone, I have the thyroid, I have the cricoid, I have the arytenoid, I have the corniculate, I have the epiglottis, I have the false vocal cord, the true vocal cord, the space between them is the glottis, I have the trachea, epiglottis, and stuff. Okay, on this lung model, taking a look at the top here, I have a vertebrae, I have an esophagus, I'll try to go a little bit more in order. I have a vertebrae that just jump all over. Okay, I obviously have the celiac artery or trunk coming off. I have obviously the aorta showing up here. So this is kind of like I'm cutting into the aortic arch, descending aorta. Okay. The lobes of the lung, I have on the right side I have an inferior, middle, and superior lobe. On the left side I just have an inferior and superior. When I take a look at the trachea coming down, the trachea has a membrane on the back for the esophagus to expand into. Okay, it comes down. Its split is the carina. That's the bifurcation. Then they become circular branches of cartilage, so they're the bronchi. The bronchi split into bronchioles. I'm at bronchus or bronchi. We have primary. The next time they split, they become secondary. If they split again, they become tertiary bronchi. Carina, trachea, esophagus. Here I have the diaphragm. Here I have the esophagus coming back behind this. Okay. Here I have vertebrae, esophagus, and trachea. Once the trachea stops, we see the esophagus coming down, and we also see the aorta. So the things that are penetrating through the diaphragm are the aorta, and here we have the esophagus going to the stomach.
So larynx and pharynx both end at the epiglottis, and then from there you have the esophagus.
We go into trachea. So this model here showed you that, because here, this is where the trachea starts, has a membrane on the back. We normally don't breathe when we swallow, because the bolus of food expands into the trachea. Okay? It doesn't block the trachea, but usually when we swallow a bolus of food, the esophagus is normally always collapsed, unless a hunk of food's going down. When that hunk of food goes down, it expands into that membrane and pushes on the trachea. So we normally don't breathe when we swallow, but let's say something gets stuck, we still can breathe, but we feel fairly tight just because it's pushing on the trachea so hard. We still can get air in and out, but it doesn't stop us from breathing, but it pushes on that. Never liked this model. You know, I may limit what we do on this. Okay, first of all, this is a microscopic model of the lungs. The little small grape-like clusters are alveoli. Okay, everyone should kind of realize that. So the alveoli are all of these little grape-like clusters. Okay, they're microscopic. Okay, so most everything we're looking at here, this is showing a capillary bed surrounding the alveoli. Okay, now we have mucus we don't have mucus in the alveoli, but in the bronchioles we do. So this green is a mucus gland. Okay, now when we look at venules and arterioles here, what color would the venules be?
Blue. Red.
Okay, we're in the pulmonary system, so they're red. So the pulmonary venules here are red. The pulmonary arterioles are blue. We're delivering blue blood to the lungs, becomes red. We're returning it to via the pulmonary venules. Okay. This happens to be a bronchiole. Okay. Bronchioles still contain some cartilage, so this light blue is cartilage.
What's a bronchiole?
Bronchiole here, this hole right there.
Okay.
Bronchioles still have cartilage. Okay? The cartilage maintains their shape. They can't collapse. Okay? When we get into terminal bronchioles have these rings of smooth muscle on them because they actually can constrict and dilate. Okay? So we have some terminal bronchioles with rings of smooth muscle around them. Okay, there's a respiratory membrane that lines this. You've seen it before because what we're going to see is cilia and goblet cells. Okay, when we take a look at the pleural membranes on this, our thoracic cavity is lined by a membrane, and we also have a visceral pleura that lines the organ. This allows them to slip amongst each other. So we have a serous membrane that makes it slippery. Okay? So we have the visceral pleura, which is what lines the organ. Okay, respiratory epithelium inside, capillary bed surrounding the alveoli. The alveoli, alveolar sac, I'm not sure what I would pick on that. Okay? The green mucus gland, the cartilage here, pulmonary venule, pulmonary arteriole. The bronchiole has the blue cartilage. A terminal bronchiole is any of these tubes here that have rings of smooth muscle on it. So I think there's one here, there's one here, there's one here. Okay? A respiratory bronchiole is really just like an airway that still has bubbles on its side. Okay? So this is a histologic model. Okay?